Senator Kohl, you have the floor to open debate.
Thank you, Mr. President. Senators, over the last several sessions, this legislature has taken deliberate steps to solidify Idaho's commitment to equal treatment, merit-based decision-making, and responsible stewardship of public funds. At the same time, the current administration has been moving to scale back, reshape, or eradicate DEI policies at the federal level. So as a nation, we're seeing a shift back to a merit-based approach in all forms of government and institutions across the board. This legislation before you, the Merit-Based Healthcare Act, applies those same principles within Medicaid-funded healthcare. When taxpayer dollars are involved, employment and contracting decisions should be based on professional qualifications, clinical competency, and the quality of patient care. A merit-based healthcare system strengthens trust, improves outcomes, and ensures that resources are directed towards excellence and efficiency. This bill does not authorize discrimination, and it expressly preserves compliance with federal civil rights laws and Medicaid requirements. What it does do is reaffirm that public funds should support systems built on competition, quality, and individual achievement. This bill stops discrimination. A merit-based approach to education and healthcare benefits all Idahoans. By emphasizing measurable performance, professional standards, and equal treatment under the law, we promote higher quality institutions and better service to the public. In doing so, we move away from politically charged frameworks that can divide institutions and distract from core missions, and instead reinforce standards that encourage excellence and accountability. Senators, just to briefly walk you through this legislation, on the first page we have legislative findings and intent. I think the most important part is on line 21, where we state Medicaid participation is voluntary and subject to reasonable conditions imposed by the state as a steward of public funds. On the second page we have the definition of DEI, some of the concepts that we're talking about here. I'll just go through a few of them. The concept that one race is inherently superior to another race or sex. Another concept that the United States is fundamentally racist or sexist. Yet another concept is that an individual's moral character is necessarily determined by the individual's race or sex. When we talk about prohibited acts, we're talking about DEI. That was just defined. And there's also a section in here that allows for patient-specific medical discussions related to biological, genetic, or epidemiological risk factors, collection of demographic data for legitimate clinical care, quality reporting, or public health standards. So I think this bill strikes a really nice balance, making sure that we're not discriminating individuals based on their sex or their race, but also having a common sense approach to our medical care and allowing our medical professionals to make those decisions that are important when it comes to the practical care aspect. Legitimate care is mentioned in this. There's also a warning where if a medical group is found to be in violation of this legislation, they're given a written warning and an opportunity to rectify their mistakes. So there is a grace element built into this legislation. There is a penalty for getting that warning and going beyond, not changing, not rectifying the issue at hand. And those penalties are written in the legislation. To wrap up, there is a limited private right of action where a healthcare professional who believes they have been retaliated against arising from refusing to participate in prohibited DEI conduct can have litigation. With that, Mr. President, debate is open.
Is there further debate? Hearing none. Senator Kohl, you're recognized to close debate.
Thank you, Mr. President. Thank you to the senators from 19 and 4 for the debate. I would just reiterate page 3, line 15. Going up to paragraph 2, nothing in this section shall be construed to prohibit. And then there is a list of things that are allowed. And I would say it's rather broad. Line 15, non-ideological training required for clinical competency, licensure, accreditation, or federal program compliance. That's just one of the items that is not prohibited. The Attorney General has discretion on what complaints to follow up on, and there is a warning period. So if someone is trying to be a good faith actor, they have an opportunity to get on the right side of this statute without any penalties being put to them. At the end of the day, senators, let's go back to what this legislation is prohibiting. And just think, I want you to think about whether or not you are okay with a Medicaid-funded institution teaching or hiring based on one of the following concepts. The concept that one race or sex is inherently superior to another race or sex. Are you okay with your taxpayer dollars going to that? If an institution is hiring or training based on the following concept, an individual's moral character is necessarily determined by the individual's race or sex, I don't think that institution deserves a dime of taxpayer dollars, because those concepts are inherently un-American. Senators, what this legislation does is strike a good balance between making sure that our healthcare professionals are able to do their job in a competent way and ensuring that our taxpayer dollars are provided for with accountability, and that our taxpayer dollars are going to institutions that hire based on merit, based on competency. That's what our Idahoan citizens are expecting when they walk into a healthcare clinic. At the end of the day, Medicaid is voluntary, but it is up to us as a legislature to make sure that our taxpayer dollars are being stewarded well. This legislation gets us further to a dream a great man had decades ago, where we would be judged on the content of our character, not the color of our skin. With that, Mr. President, debate is closed.
Debate is closed. The question before the Senate is, shall House Bill number 928 as amended in the Senate pass the Senate? The Secretary will call the roll.